good afternoon, good morning, good evening, everybody. My name is Hussein Jaffrey. I am the founding director as well as the CEO of the World Patient Alliance. And it's my great pleasure to welcome you all to this important webinar, The Promise of Personalized Medicine, organized by the World Patient Alliance in collaboration with From Testing to Targeted Treatments, FT3. Next slide, please. So this webinar is going to be transmitted into through AI simultaneous translation in over 60 languages. The link will be in the chat box. So you just need to click on that link and you will, in this window on the left hand side will open. You just have to select the language in which you want to listen the webinar, put your name and just, click attend. Another window will open and just click on this speaker and you will listen to any language you want, Arabic, French, Spanish, any language, Hindi you want to listen this webinar in. Next, please. So personalized medicine represents a paradigm shift in healthcare, one that moves us away from one size fits all approach to the one that is tailored to the unique genetic, environmental, and lifestyle factors of each individuals. And this approach has the potential to revolutionize patient care, ensuring that the right treatment is delivered to the right person at the right time. And today we are gathered with a distinguished panel of experts, patient advocates, and healthcare professionals to discuss this incredible opportunity that personalized medicine presents, and the barriers that exist, and the role of patient organizations in advocating for equitable resources. So the aim and objective of this webinar is to share knowledge about the fundamentals of personalized medicine and its potential to improve patient outcomes, empower advocacy efforts by highlighting the crucial role of patient organizations in expanding access to personalized medicine, and also to inspire action by providing practical tools and case examples to influence healthcare policies and clinical practices. I encourage you all to actively engage in today's discussions, ask questions, and explore how we can collectively work together towards a future where every patient has access to personalized care that they deserve. So thank you very much again for joining, and let's begin this very important conversation. Next, please. So we have a very distinguished line of speakers and panelists for today. So let them, introduce themselves. So I'll ask each of one of the speakers to introduce themselves very briefly. So I'll first ask Dr. Marius Gineta. Can you please introduce yourself?
Hello, good afternoon. I'm Mario Janta. I'm a medical doctor by training. I studied public health for 4 years, and I have a PhD on artificial intelligence and cancer literacy. I'm, I think, a veteran in the field of personalized medicine. I'll explain in my lecture why. And I think it's relevant for our today discussion to say that I'm the co-lead of the strategic board of the International Consortium for Personalized Medicine, in charge with policy activities. And I'm representing my home country, Romania, to the 1+ million genome initiatives. As well, I'm the co-founder and the president of the Center for Innovation in Medicine.
Thank you, Dr. Marius. Now I'll request Bahija Goimi from Morocco. She is a patient advocate.
Thank you, Hussein. Hello, everyone. Thank you for having me. I'm really honored to be a speaker of today's webinar. My name is Bahija Goimi. I'm the president and the founder of Amal organization based in Marrakesh, Morocco. And I'm doing activity for more advocacy activity in Morocco for more than 23 years. And I'm also representing Africa and Middle East in many organizations. Thank you.
Thank you, Bahija. Now I request Renchi Chiadebi from Nigeria.
Okay, yeah. Greetings, everyone. My name is Ron CW Chidebe. I'm the Executive Director of Project Pinglu from Nigeria. I'm also a patient advocate. I'm really excited and thrilled to be here. Thank you.
Thank you, Renchi. Now I'll request Helena Henrik. She's the Executive Director of FT3 program. Helena, can you please introduce yourself?
Thank you. I'm Helena Harnick, and indeed I'm the Executive Director of the From Testing to Targeted Treatments program, which we call FT3 for short. And I'm so pleased to be here and co-hosting this session together with the World Patients Alliance. The From Testing to Targeted Treatments program is a not-for-profit collaborative partnership, and we aim to improve patient outcomes by bringing to life the potential of precision medicine and personalized healthcare when the patient could benefit. And we work in partnership with the patient community and also with healthcare professionals, academics, companies around the world to understand what are the challenges that they face in their respective countries, and what we can do to bring solutions, which can range from educational resources for patients to use in discussions with healthcare professionals, to understanding how we can advocate for change in these different kinds of health systems. And I'm really pleased to be joined here today by many familiar faces and friends from people who are also involved in the FT3 program. Thank you so much.
Thanks, Helena. And last but not least, can I request Andrew Spiegel, the chair of the World Patient Alliance, to introduce yourself?
Sure. Thank you, Hussein, and thank you to all the other speakers. My name is Andrew Spiegel, and I am currently the board chair of the World Patients Alliance, and very honored to be in that role. I'm one of the co-founders with Hussein and the other board members of the WPA. But I've been in the patient advocacy community for 26 years since I lost both of my parents to two different cancers 2 days apart. And I co-founded the first ever colon cancer patient organization in the United States. And now I'm the CEO of an umbrella organization for all colon cancer groups around the world called the Global Colon Cancer Association. So it's in those two roles that I'm going to be talking a little bit today. But the real role that I'll be talking from today is that of caregiver to my wife, to talk about her cancer journey and how personalized medicine affected her and our family, and really the promise of personalized medicine, what this whole webinar is all about. So I'm going to be speaking about that in a little bit, and really excited to share our personal story of personalized medicine, as well as speak from a patient advocate's viewpoint who launched our personalized medicine initiative the same day my wife was diagnosed with cancer. So I'll be telling that story soon, and happy to be here to share that with everybody.
Thanks, Andrew. Looking forward to hearing your story. So just for the participants, if you have any questions, please write your questions in the Q&A box, not in the chat box, but in the Q&A box. And once we have heard the presentations and we are in the panel discussion, then our panel moderator Helena will take up the questions. So please put your questions in Q&A if you have any questions. Next, please. Now I hand over the presentation to Dr. Marius Ganeta on introduction to personalized medicine. Over to you, Doctor.
Thank you so much, Hussein. And again, I'm very honored to be here with you all and to share a few ideas, few thoughts from my experience in the field of personalized medicine. So this journey started in 2012 when trying to find a professional route for myself. I actually interact for the first time with this concept of personalized medicine. And for the first lecture, I have been invited by the Federation of the Associations of the Cancer Patients from Romania. And this group was the first interested in the field of personalized medicine. And this aligned very well, and is still aligned with my idea that actually the patients and the family are the main drivers of personalized medicine, could be the main drivers of personalized medicine and health innovation overall. Started to speak about personalized medicine more than 10 years ago. I actually had the same, more or less the same type of reactions, especially coming from the healthcare professional, saying that, doctor, is really interesting, this concept of personalized medicine, but, this is something, for the future. But the future of then is actually the present of today. And in my presentation, I will briefly explain to you the origin of the concept of personalized medicine at European level. Where are we now? What were the expectations more than 10 years ago? And some of the barriers we actually experience, and in our discussion later on, we'll have the chance to discuss more in depth about this. So next slide. What is actually personalized medicine? And this definition was put forward 10 years ago by the EU Council. Was a very long process, more than 2 years of discussions with experts across Europe in a collaborative format to define personalized medicine. And the idea is personalized medicine is not replacing the traditional medicine, but is something that takes the advantages of the technological era we are living in. So we have a lot of technologies now. We are able to generate more relevant data. So being able to capture this data related to different phenotypes and genotypes, like molecular profiling or medical imaging or data related to our lifestyle, this will help us to better define our own health as individuals, but as well our diseases. And this actually paved the way to tailor the therapeutic strategy, the right intervention strategy for the right person at the right time. And as you can see in the definition actually is covering the diagnosis and treatment part. So what is related to the patient, but as well the primary and secondary prevention, early detection of the diseases in a personalized way. And this is how you should understand the personalized medicine, like an area who is actually capitalizing on the technological developments and intersect the primary, secondary, tertiary prevention and care. Moving to the next slide, the idea is that according to the, let's say, traditional medicine, two people are diagnosed with the same disease, but basically it's the same disease. The answer for most of the cancers is, of course, not, because, of course, we can go for the traditional classification of the disease organ specific, but if you go into more details, genetic details, biological details, you can see a lot of differences. So in principle, two persons are diagnosed with the same disease according to the traditional classification of the diseases, but in practice, they experience the illness in a different way. So each of us is unique, and we experience in a unique way the disease. And personalized medicine is the concept who put this really person-centric and disease-centric approach in the core of the interventions. So moving to the next slide. Why this is happening? We know that our health is actually influenced by a lot of factors: genetic factors, biological factors. Health system influence our health, and as well the physical environment, but social environment and individual behavior, such as our habits. So we are so different. And with the technologies we have now, I say once again, we are able to better define this, the health determinants and the disease. That's why we are now in the position to consider that personalized medicine could be a reality for patients if they are diagnosed already, but as well for citizens in terms of primary and the secondary prevention. Being able to go with this personalized approach to health and the diseases, we might expect to have a higher efficiency of the prevention programs as well as treatment we are choosing for different diseases. Moving, next slide. You can see here a representation on what personalized medicine means in practice. Generalized medicine is follow the idea one size fits all, the same treatment like chemotherapy delivered to all the patients. If you apply the personalized medicine, you are able to stratify the patient and to choose the right therapeutic strategy for a certain group, very well defined of patients. Next slide. And the core of this high definition of the diseases rely on the identification of the biomarkers. And you should think to biomarkers like some red flags or blue flags at the, let's say, if we discuss about cancer, at the tumor level, flags who signal that, this is where a treatment should come in order to be really, really efficient. And in the last year, we have been actually in the situation to see a developments in understanding of relevant biomarkers, but as well in terms of approved therapies requiring biomarker testing. I think this graph is relevant on one side to see 2011, 2012, an increase of these personalized therapies approval by FDA. But then in the last year, you can see as well like a plateau. It looks like we reach like potential now. Moving forward. Next slide. And of course, oncology is benefiting the most from the personalized medicine application. Many cancer types, starting probably with melanoma, then moving to colorectal cancer, as well lung cancer, are benefiting a lot from personalized medicine. Of course, rare diseases, and I think rare diseases could be like the best demonstrator for what personalized medicine means or should be in clinical application. And other areas such as neurology and immunology, the developments of personalized medicine are not so high. And unfortunately, cardiology, and this is something I think unacceptable because we have evidence about familial hypercholesterolemia, very high level of cholesterol determined by different gene mutations. And there are some WHO recommendations on how to apply personalized medicine for FH patients that are not actually following in the practice. So a lot of things should be done, at least in some areas, but the progress shouldn't be so slow as we experienced in the last years in oncology and rare diseases. Next slide. As I mentioned, more cancer treatments are now, personalized cancer treatments are now available, so-called targeted therapies. And you can see here how many cancer types are actually benefiting from the development of biomarkers and targeted therapy. As I mentioned, hematological malignancies, colorectal cancer, breast cancer, and lung cancer, melanoma, and so on and so forth. So a lot of cancers are benefiting now from targeted therapies. Next slide. The conclusion is that, of course, this increased the eligibility of patients that can receive a targeted therapy. But next slide, in practice, the access to targeted therapies is low in some of the countries, it's higher in other countries. So we can see a mixed figure when it comes to access of the patients to personalized medicine. And we can discuss about potential barriers here, some of them related to the availability of the lab test and lab infrastructure, availability of the drugs, and moving to healthcare professionals, workforce, the need for education, and overall the policy landscape. And at this point, I have to share with you the biggest achievement for myself and for the Center for Innovation in Medicine. Last year, the first in the world law on the right of the citizen and patients to personalized medicine was approved by Romanian parliament and promulgated by Romanian president. And we have been actually the initiators and the main drivers for this law, trying to set the policy, the right policy landscape in our country, and hopefully the other regulations and implementations will follow. Next slide. Of course, this was just an introduction on personalized medicine. There are so many things to be discussed, and in this slide, and the organizers will share with you the links. In this last slide, I put some resources for you if you like to learn more, and in particular, because I'm involved in the International Consortium for Personalized Medicine, I strongly encourage you to be in touch with us at ICPERMED. ICPERMED has now 2 strategic boards. I mentioned one I'm involved with on policy, but the other one is on internationalization. And there are countries like Tunisia from Africa who expressed the interest to join ICPERMED. So I think it's a very good momentum to build new synergies. And very important is the European Partnership for Personalized Medicine, so-called EPPERMED. This is relevant because every year the EPPERMED is launching calls, and the patient groups, of course, are eligible. And another important point here is the focus on patients and citizens and literacy. So this the involvement of the patients and citizens are explicitly mentioned in the strategic research and innovation agenda of the EPPERMED. I will finish with this, but we will continue the conversation later on. Back to you, Hussein.
Thank you very much, Doctor. I think it was extremely informative, at least for me. It was very informative, giving me a perspective, an introduction to personalized medicine. So thank you very much. So now we move on to the next part of the meeting, which provides us an opportunity to hear from patient organizations, how they are driving personalized medicines forward with real-world success stories from FT3 community, basically showcasing their power and influence. So we'll start with personal story of Bahija and her journey to access personalized medicine, which led to take an active role in her community in Morocco. And then we'll move on to Ranchi, who will then, we will learn from him what can be done to increase patient education and awareness in the area of personalized medicine. And I'm sure with these examples, we hope to provide tangible examples of what can be done even in resource-limited settings, or even in countries where access to innovative therapies is still limited. So over to Bahija. Bahija, you are mute. Bahija, you're mute. Need to unmute yourself.
Sorry for that. You hear me now?
Yeah.
Okay, thank you very much. Thank you, Hussein. And very good opportunity to share my story. Today, I would like to share my journey through this journey map. Actually, in 2002, I was diagnosed with CML, chronic myeloid leukemia, a type of blood cancer. And it was during pregnancy, a deeply overwhelming experience. And I was terrified not only by the cancer diagnosis itself, but also by the possibility of losing my baby. And I still remember the words of the doctor saying, "You have only 3 years to live." And at that time, in 2002, there were no treatment, patient organizations or support available. And my family and I suffered from care centralization. In the same time, I had to juggle, working and taking care of my 3 kids, children, and also traveling more than 1,400 kilometers over 4 days every month to receive life-saving treatments. And in the same time, in clinics, I faced inequities. Most patients were illiterate, without health insurance, no access to treatment or clinical trials. And so I started engaging with patients, caregivers, physicians, and also attending trainings, meetings, and congresses just to gain knowledge and to understand, but also to build a network. And all these experiences inspired me to dedicate my life to founding Amal organization. And in 2022, we built and inaugurated Dar al-Amal facility. It's a patient facility providing dignity and support to cancer patients and their families who travel very far from village and far cities from home for treatment. And this is how I turned all my pain into purpose, and I transformed my personal struggle into a collective mission for change. Next slide, please. You can see in this slide, over time, patients have evolved from a disease, a passive recipient, a client, a consumer, a healthcare user, a digital patient, an expert, an advocate, to an empowered part of patient groups, patient organizations, and also network or alliance. And this reflects exactly, progress in patient-centered care, shared decision-making, and co-creation of solutions, but also holistic approach and the digital revolution. I think advocacy is essential because nothing for us without us. I learned to never underestimate, myself, my voice, and my story, because we can move mountains and inspire and empower others people. And I still remember when I finally got the first box of targeted treatment that I brought from Spain. I was very proud to show it to my physician, thinking, look, I am a hero for bringing this medication for the first time to Morocco. But when I saw other patients in the waiting room, in the same room, without any treatment, I felt guilty, and I hid my medication box. And looking back, I think that moment was the first act of advocacy. Next slide, please. And now, let me share with you some key lessons I have learned. The first one, we can't advocate for others if we are not well. Taking care of our health and emotions come first, and also coping mechanism and sincerity and authenticity are vital. And the second lesson is that advocacy is not complicated and doesn't require perfection, doesn't require to be really 100%. I remember I started advocacy without knowing it was advocacy, and we don't need to be at the top or to begin. We start small, take simple actions and build from there. You will gain experience and so on. And the third lesson is for sure that advocacy is a journey of continuous learning and growth, gaining experience through actions and learning by doing. Every day you have to learn something new. And I never imagined, for example, that one day I will meet the Minister of Health to advocate for patients and to secure the first line targeted therapy and pushing for the reimbursement of the second line therapy in Morocco. It was a success story, and I'm very proud that our patients in Morocco now had the 2-line therapy. I'm sure that we have, a critical role to improve access to precision medicine, especially in low and middle income countries, because precision medicine is not a luxury. We deserve to be treated with dignity and also to have, the right treatment in the right time for the right patients. Another key learning is to seize opportunity as they come and to build strong relationships and partnerships, and also recognize the shared responsibility to speak up. And I think that I believe, and I'm sure for that, and everyone will share that with me, that every advocacy skill we develop starts with us, because we can change the world, we can change people unless we are willing to change ourselves. And advocacy also is, for me, is universal because we are all advocates for a better life within our families every day. So we all have a role to play, and we are all responsible in this field. And we need also to advocate. We need to advocate for access. We need to advocate for dignity, for hope, but also we need to advocate with love. Next slide, please. Now I will talk about challenges, and despite progress, we continue to face challenges, such as, for example, resource limitation. You know that advocacy requires many people and tools to run effectively, and if funding is low, it becomes very difficult to expand, for example, campaigns, provide services, or reach target audiences. The second challenge is resistance, and this is the big challenge because advocacy work can face resistance from people, sometimes for patients themselves, sometimes, and this is the majority is the systems, because they want to see the change due to the cultural norms or political will. And the next challenge is the awareness gaps, and in low and middle income country, we are suffering from language barriers, and advocacy requires clear communication. But sometimes misinformation or language barrier can make it hard for the public to understand the issue or, for example, to take action. And the next challenge is fragmentation, because advocacy groups working, separately, independently, or with conflicting goals can create fragmentation. And this challenge can reduce, the effectiveness of their efforts and waste valuable resource when we are, doing advocacy activities. Communication sometimes it's very difficult to gain the media attention or to control misinformation. Another one is the legal constructs. In some region, government impose censorship or legal restriction that limits advocacy efforts. In some countries, especially in Africa and Middle East, it's forbidden to create a patient group or an organization, in civil society. Advocacy outcomes aren't always easy to quantify. This is what I am talking about, how to measure impact, especially for long term, like, for example, changing public attitude or influencing policies. And the other challenge is burnout, because we are all working as a volunteer. Advocates, many of whom are volunteers, and they can experience emotional burnout from dealing, with heavy workload and slow progress, and also emotionally charged issues. And sometimes we have another challenge is the external crisis. Sometimes the global event, like, for example, economic crisis, pandemics like we experienced it with COVID-19, or wars can pull attention and funding away from advocacy causes. And it could slow, the progress regarding advocacy. I will stop there. Thank you for your attention, and for sure I will be happy to answer your question. Thank you.
Thank you, Bahija. And can I now request Renchi to tell us your story, how you educated patients in Nigeria. Over to you, Renchi.
Okay, yeah, thank you very much. It's always really exciting every time to have a brilliant speaker and a powerful champion, really, and a survivor speak first, because Bahija has just really given me a very soft landing. So I really want to thank you so much, Bahija, for that wonderful presentation. Yeah, so my name is Ron CCW Chidebe. I'm the Executive Director of Project Pinglu. By training, I'm a psychologist, and I'm also a patient advocate. So today I'll be discussing accelerating care level activation of precision medicine with educational materials for patients and providers. Next slide, please. So I really want to start this presentation by at least providing a bit of an introduction to what exactly is Project Pinglu, the organization I work with, as well as talking about a little bit about the Nigerian healthcare system, the precision medicine landscape in Nigeria, as well, and also in Africa. So Project Pinglu is really a patient-focused organization. We are engaged in public awareness, fundraising, palliative care, oncology education, research, psychological support, patient navigation. We've been doing a lot of work. Every single year, we mobilize about 3,000 people to walk on the street of Abuja to create awareness on World Cancer Day. And we use this platform to really engage our community, to educate our community, as well as empowering patients and their caregivers and the people on what we know about cancer, what we need to do, and what needs to change. More importantly, also speaking truth to power on what the government needs to do to bring about the changes that we want in our country in cancer control. Next slide. So, in all our work, I'm very happy Bahija has spoken eloquently about patient advocacy. But my presentation today will focus more around patient engagement. And I think it's really good to always try to define that so that people can really understand the difference, right? When we talk about patient engagement, it's very, very different, because it's really about the active and meaningful engagement, or the active and meaningful involvement of patients and their caregivers in the development of medicine, in the design of research, whether clinical trial, cross-sectional study, or whatever. Also in the development of devices, right? As well as, in development of care practices and programs that's really targeted at supporting the patient. And Project Pinglu have been in the forefront of using patient engagement principles in the project that we do. You can see here, this is a picture of all our cancer survivors and myself in the middle, smiling, very happy. This really is a picture of us, what we call the faces of hope, where we bring cancer patients together to really let them understand that, hey, you are the faces of hope. The reason is because you have survived. Don't remain in the pains of cancer, but move away from the pains and get involved in the hope, and get involved in the resilience, and get involved in research, and get involved in development of care practice. Lift your voice. Know that you have the power. Your voice is your power, and with your voice, you can make that change that we need And through that, we've engaged our patient in research. We've engaged the patient in different programs and activities in Nigeria. Next slide, please. And then we have also been involved in sort of some patient advocacy activities. Here is a program that we've been partnering with the US Department of State. Every 2 years, we bring about 2 professionals from the US through Fulbright Specialist Program to come to Nigeria to provide training to empower the healthcare system. So here is, in this picture you can see, is a US oncology pharmacy professor who came to Nigeria to provide oncology pharmacy training to our Nigerian oncology pharmacists. In 2018, we had 2 medical oncology professors. We also had nurses, we've had pathologists, and all the rest of them. Next slide, please. So at this time, I think I really want to dive into really the core message of today, which I am really excited about, because when we talk about personalized medicine, we talk about precision medicine in many conversations all over the world, and you are speaking from someone from Nigeria. The concern will always be like, oh my God, is anything like precision medicine happening in Africa? Well, the truth is that, precision medicine came into place around 1970s or so, right? And, some scholars have done some literature searches and have found that only 630 articles have really discussed precision medicine in Africa. And out of these 630 articles, only 21 were really focused on work that were associated with genomic science, and doing some kind of clinical trial and randomized clinical trials and randomized control trials, right? And out of these, about 46 authors who really pioneered this work, and these 21 works, only about 34 were actually affiliated to African institutes, and right now we know that in Africa we have about 11 research consortiums that are really involved in promoting precision medicine as well as also promoting genomic science. In the area of North Africa, countries like Tunisia are doing amazing work, Morocco as well as doing amazing work, as well as Algeria. But when we come to Sub-Saharan Africa, you really realize that the main country that is really at the forefront of precision medicine will be country like South Africa, actually. In fact, South Africa have a proper tailored funding on precision medicine. They even have a proper plan on precision medicine, on how to advance precision medicine in their country and in the region. But the cross here is that other countries in Sub-Saharan Africa and other countries in the whole Africa are really hoping and making huge progress around that. But the challenges of lack of infrastructure, medical infrastructure, biobanking, laboratory capacities, research funding, and low awareness of precision medicine, workforce issues, health system issues. These have been the issues that have been really causing a huge barrier to most of these countries in Africa, and even Nigeria in specific, in making progress in precision medicine. Next slide. Next slide. So, when we discovered, okay, these are all the challenges in precision medicine, we asked ourselves the question, what can we do? What can we do to begin to find a way to educate our community and all the rest? Out of all these four challenges that I highlighted, we discovered that what is most powerful could be to try to use a bottom-top approach, which could also be defined as a care level activation approach. So we wanted to really find a way to educate the patient so the patient can begin to demand for it. The patient can begin to ask questions that, hey, I see this on Google, I see this here, I heard about this. Can I know what exactly is happening? Can we know about it? Can we talk to our policymakers and all the rest? And so through the partnership with From Testing to Targeted Therapy, From Testing to Targeted Treatment, I beg your pardon, Project Pink Blue work with the F23 program to collaborate and adapt the materials that F23 have actually developed. So they had so many materials, but we looked at 3 main materials as a first of pilots. The first material we looked at is the question to ask your care provider. And these questions are really important questions because what we have found even in our own patient is that patients have a lot of concerns, they have a lot of questions they want to ask the doctor. But once they get into that hospital, they forget everything. So having that material that provided guidance, support patient is so powerful in activating conversations around precision medicine. The next material was the targeted therapy, for cancer. The third one was biomarker testing for cancer. So we had this material. We had a breast cancer survivor in Project Pinglu team, the breast cancer survivor, myself and my other colleague. We reviewed this material. We look at the context. We look at the language, ensuring that the language in this material are plain language. And then we went on to the next level. Next slide, please. So what is the approach that we use? So the approach we use we use 2 approaches because we really wanted to understand what is the patient's feedback about these adaptable materials, which is great, this is usually a great approach that is used in different parts of the world. But we said, no, let's also add a focus group discussion to it so that we can have the patient look at these materials and tell us what this material look like and tell us, do they understand this material? Would this material be useful to them? What do they think about it? And what we did was that we recruited about 71 cancer patients from the support group that is supported by Project Pinglu in Lagos, in Abuja, and Enugu. And we also had about 76 participants that participated in this focus group discussion in these different 3 locations. And prior to that, we gave them these materials and have them to read these materials ahead of time and ask them, when they arrive the focus group discussion, we now started the conversations around this material, the usefulness, the comprehension, and also the understanding, the clarity of the information around this precision medicine that we have shared. And finally, we also engage them on asking them questions around what is your access to precision medicine? Let us know, have you really accessed it? Do you know anything about it? And those kind of questions. Next slide, please. And so these are the very important findings and the insightful things that we learned through the support, through the survey, as well as through the focus group discussion. So it was just so interesting that all the patients confirmed that the material were very useful to them, that this material helped them to really trigger conversation, to start conversation with their doctors. And the challenge have always been that doctors are very, very busy. But when they are able to ask questions that were very specific to how their diagnosis was made and how their treatment is going to progress, the doctors really got interested to learn more and got interested to talk more about them. And patients also experienced that they never had access to material like this. Their doctors and healthcare providers never at any point in time gave them this kind of materials. So, all they know about their treatment, they actually have to Google it, or they have to use the internet, or even hear from other patients that they meet at the cancer support group. And I would really say that this collaborates with a previous study we did with advanced breast cancer survivors, Advanced Breast Cancer Global Alliance, which really showed that about 90% of cancer patients in Nigeria, and technically most countries in Africa, really access information through internet, through Dr. Google. And then, so the recommendations that we got was that, yes, even to people who are not survivors, including family caregivers and all the rest, really also need to get this kind of materials because it will help them to really understand the power of precision medicine and why this is really important for care. Now, the interesting thing was that we also discovered that most of our cancer survivors really are on targeted therapy, which is a type of precision medicine. However, most of the patient did not even know that this is actually what it is. So they are really on this therapy, but they don't know what it is. They don't even know that this is actually what it is. So this really underscores the power of patient education, the power of trying to activate precision medicine, not just from the top-bottom approach, but really looking at from the care level, from the bottom, from having the patient themselves to be the ones to create the demand to ask these questions. Next slide. Next slide, please. Next slide. Okay, thank you. That's fine. That's fine. Yeah. So, and then it was really interesting. In fact, one of the patients said in one of the quotes, one of the qualitative quotes, he said, some of us are actually taking this medication. Unfortunately, we didn't even know that what we're taking is targeted therapy. We didn't even know how important this therapy was. If we had known, we would have struggled more to find money, even though this therapy is so expensive for us to afford. We would have found money to ensure that we get it and also encourage other patients to take it. So one of these quotes and so many of the quotes from the patient really show that educating patients is so important because it will help patients to have a better understanding, health literacy, help them to really understand that, hey, this is what this treatment is going to do to you, and it will really empower them to really drive and push more for how they are able to get survivorship. Now, some of the feedback we got is that the translation of these materials are so crucial, and cost of targeted therapy is huge, it's very expensive, so that's a very serious issue as well. Our next plan of action is that we're hoping to submit a full report to Federal Ministry of Health and as well to National Institute on Cancer Research and Treatment. We're also planning sometime in June a national dissemination webinar. We're also pushing for a publication. We had just submitted an abstract to ASCO, crossing finger, hopefully is accepted, and we can also share our voices there. And we also have a demonstration pilot that we're hoping to do with healthcare providers. I think I'll pass the microphone over now to Hussein. Thank you so much.
Thank you, Renchi, and thank you, Bahija, for excellent examples of how patients, just being individuals, can really, come around and bring about change in their own countries. So I think that's a lesson for us to learn. Now we move on to our panel discussion, and I'll hand over the mic to Helena Harnick for conducting this panel discussion. Over to you, Helen.
Thank you so much, Hussein, and thanks again to Ransi and Bahija for sharing your stories. I've been following the comments in the chat, and I think it underscores how beneficial it can be to have a forum to be able to share experiences like this, what has worked, what you've tried, best practices in advocating both at the individual patient and kind of collective level. So it'd be wonderful to be able to expand on this a little bit more in the conversation that follows. Just as a reminder, I wanted to invite you all listening today to submit any questions you might have in the Q&A chat. I guess it's different from the chat, but feel free. I see some questions have been already coming in, but please feel free to add that in, and we'll do our best to answer them in the course of the presentation or indeed after the meeting today. So while you gather your thoughts, I wanted to kick off the discussion with the panelists we have today. I was wondering if we could actually start with Andy, because Andy, you had shared that you had a personal story that you wanted to bring to this group today, and I was wondering if you would be kindly able to share your personal story and to tell us more about your role with the Global Colon Cancer Association. In your story, I'd be also keen to hear about partnerships between global and local patient organizations and how those can accelerate progress. So if it's okay for you, Andy, if we could kick off with you.
Sure thing. Thank you, Helena. So as I mentioned in the introduction, My primary role in the advocacy community is as the CEO of the Global Colon Cancer Association. Great to see some of our members on this call, including Runcie, who's doing an amazing job in bringing awareness to Nigeria about colorectal cancer. But back in March of 2020, my organization, during Colorectal Cancer Awareness Month, which is March, launched a program called Know Your Biomarker. That's KNOW, your biomarker. And we got that website, knowyourbiomarker.org. And in fact, on the day we were launching that program, it was an evening webinar we were doing for all of our members. We're an umbrella organization to all colon cancer groups and often pan-tumor groups that also do colorectal cancer all around the world. And we were launching that program in the evening here in the US and introducing our new website, knowyourbiomarker.org. And on that website, we launched what we thought was a full menu of everything our patient group members needed to know about personalized medicine and biomarker status. So the first thing we did was we captured patient videos. And if you go to that website, you can watch videos of patients literally whose lives were saved due to getting personalized medicine, due to finding out that they have an actionable biomarker through biomarker testing, and then going on to a clinical trial 10, 15 years ago for now what are state-of-the-art medicines, and they're still around. These people were end of life, but they're still around 10, 15 years later with no evidence of disease because they were able to access personalized medicine. Now, this isn't everybody that's eligible for this. Unfortunately, it's a small number of people that are eligible, but the more people that we know get tested for biomarkers, the more people will be eligible, just like these patient stories that we put on our website. We also put an advocate toolkit on there, so advocates around the world can take our toolkit and start advocating for biomarker testing in their own countries and getting access to personalized medicine. And you're all welcome to go to that website, knowyourbiomarker.org. We've learned that other NGOs around the world have contacted us, have asked us, can they copy our website for their specific disease? In fact, one of the stomach cancers groups in the US just copied our website. And we have no problem with that because we're proud that people like it enough that they're finding it useful in their own disease state. So really all the learnings on that website are not specific to colon cancer. But if you do look at, say, our physician education program, we developed a poster that has all the known actionable biomarkers for colorectal cancer. And each one of those on that poster has an individual QR code. The healthcare providers at our conferences love these posters because now they have it in the office. And number one, it serves as a reminder they have a colon cancer patient coming in today. They have to order biomarker testing. And two, when the results come back, they could take the patient's phone, go to that specific QR code for their individual biomarker, and we have all microsites set up on our main website for each individual biomarker. So people can now know, what does this mean for me? What are my treatment options? What clinical trials are available? So that's a little bit about how my organization handles the biomarker status. There's much more to the story, as all of the prior speakers said, but time is limited. I suggest you go to that website, knowyourbiomarker.org, and you'll really understand this whole promise of personalized medicine in very patient-friendly language, not scientific language. So back to that March of 2020, we're just at the beginning of the COVID disease spreading across the world. And in March of 2020, my wife developed a cough. She was a 47-year-old never smoker. And we figured, uh-oh, she must have COVID. So she had, this is all before, of course, you had at-home COVID testing, before vaccines, before treatments. This was brand new. And after test, we got the phone call that my never smoker wife had stage 4 lung cancer. And we couldn't believe it. You know, she's 47 years old, was very healthy, lived a very healthy lifestyle and never smoked. And we actually got to see a doctor that day. And the oncologist said to us, I can put you on chemotherapy right away, but I suspect that there's something more going on here because you're a 47-year-old never smoker. I'd like to do biomarker testing. I knew what that was because that night is when we were launching our Know Your Biomarker program. So during that day, I'm listening to the doctor and I'm saying, wow, yes, great advice. That's great advice. And they actually did that. They took a blood draw that day. And 5 days later, we had the results of her liquid biopsy that she had an actionable mutation. She had what's called the ROS1 mutation. Only 1 to 2% of lung cancers are the ROS1 mutation. The average life expectancy of somebody with metastatic lung cancer is 9 months, if you look at the data of mean survival of metastatic lung cancer. And because of her biomarker status, she was eligible to go on a very newly approved drug. It was a pill, not chemotherapy, but it was a pill. And for 14 months, she was able to take a pill that put all of the cancer, and by the way, her cancer was not just in both lungs, it had spread. It was in her spine, it was in her hip, it was in other places. So we weren't just dealing with lung cancer, we were dealing with lung cancer that had spread to multiple parts of her body. And within 1 week of her being on this pill, she stopped coughing. And the first scans a month later showed no evidence of cancer. It was a miracle. It was, what? I'm taking a pill and there's no evidence of cancer just like that? That's what kind of experience we first had. And that drug worked on her for 14 months. She then went on another drug, another pill for personalized medicine, and that worked for a shorter time. And then it was time to go on chemotherapy because really there were no other drugs at that time for her mutation. And for 2 years, she stayed on chemotherapy, which again kept her cancer at bay. And it was not because the chemotherapy stopped working, but it was the side effects of the chemotherapy that started to cause organ failure. And we decided that we'd look into clinical trials. And she got into a clinical trial at Memorial Sloan Kettering in New York for this specific targeted mutation that she had. And again, she went on a pill and stayed on that pill for 1.5 years before the cancer came back violently. And she unfortunately passed away this past July. But she lived 4.5 years with metastatic lung cancer. And the primary side effect that she had during those 4.5 years was weight gain. She used to cry to the doctors that she's gained so much weight. And the doctors would say, look at my waiting room. All the other cancer patients have lost weight. They would love to have your problem. And that's the amazing story of personalized medicine. That because we were lucky enough to have access to personalized medicine, and we were lucky enough to have access to biomarker testing, my wife worked full time for those 4.5 years because she loved her job as a teacher. She took care of our 3 children. She took care of our house. The chemotherapy days were rough, but the personalized medicine days, she was out bike riding, walking 5 miles a day. She lived a full, excellent life directly because of personalized medicine. So I wanted to share that story. And some people felt me sharing that story isn't fair to communities that don't have personalized medicine. And my response was, it would be unfair not to share stories like this because it is from these stories that all of you in the communities that don't have personalized medicine should start advocating for it, because not everybody has to go on chemotherapy and die. Personalized medicine is saving lives all across diseases and all across the world. And where your zip code, where you reside, what your zip code is, should not determine whether or not you live or die from these diseases. So that's my story, Helena. I'm sure I went over, so I'll be quiet now, but hope that was helpful.
No, thank you, Andrew, for sharing your story and about the Know Your Biomarker campaign. But it's very powerful, and I wanted to just continue with the last point you made about the importance of advocacy, because this was a point that Bahija had made in her talk as well, like the importance of advocating. And I think the other point you bring up is about equity and access and how important that is. I know we talk a lot about that in the From Testing to Targeted Treatments program. So perhaps we can continue with that vein on advocacy. And I had also seen the question from Kareem, who had been asking a question about chronic blood disorder. And I really see that the question is about making sure we can basically advocate to be able to get more access to personalized treatments. And so for this question, I wanted to hand over to you, Bahija, since you had talked about the need to advocate for access, and of course you had shared your personal journey, but I'm wondering what advice you would give to someone who might be finding themselves in a similar situation. I imagine a lot of the people joining here today are perhaps just getting to know about personalized medicine or precision medicine, but perhaps among those who are interested in kind of going the extra mile and thinking about advocacy, what advice you would share with them, perhaps what have been the biggest challenges or learnings or opportunities that you have learned along the way.
Thank you, Helena. Actually, I don't have one advice, but three advices. But the most important things, advocacy is to start with passion and knowledge, but also persistence, because advocacy is a long journey, but only with the right approach. My first advice is to start by educating yourself and others, because education is the key. To advocate effectively, we must first understand the science and the barriers and the impact on patient, and to show what is precision medicine and what are the benefits on patients, and also learn from experts. Try to have the right information from experts, attend conferences, and stay also updated on policies in each setting and in the proper setting. But also try, because when we are hearing precision medicine, something people, they can think this is something simple. Try to simplify the message, because many patients and policymakers may not fully understand the precision medicine and what is the point after having the precision medicine and the targeted treatment. And the second advice is for sure to identify the main barriers to access, because in many countries precision medicine is still limited by cost, infrastructure, and awareness, as said by Ramsey. And try to identify the specific challenges in our region, in each region, and to ask this question, like, there is a lack, for example, of trained professionals? Are targeted therapy covered or not by the insurance? Are diagnosis tools, like, for example, genetic testing and biomarkers available or unavailable in my countries? And once you pinpoint these barriers, you can tailor your advocacy efforts to address them. And the third one is, for me, a must is to build strong alliances, because advocacy is more powerful when it's done collectively. We have to don't waste resources, but also to work effectively and form partnerships with patients, with caregivers, with doctor researchers and policymakers, and also the health authority, and try to understand what is doable to improve patient precision medicine in each setting.
Thank you so much, Bahija. And I know in the From Testing to Targeted Treatments program, we're often talking about ideas to overcome these kinds of access challenges. And we recognize that indeed, as you said, the context can be very specific in a given country. So understanding the specific situation, the specific context is important. At the same time, there are certain kinds of things that tend to be a trend. So typically, for example, we hear that the importance of the patient understanding what it is and being able to have informed discussions with the healthcare providers, making sure that there is access to the test, the biomarker test, for example. So I think those are really important points. I wanted to continue the discussion with another theme I had been hearing, again, I guess somewhat along the lines of equity and access. And we had talked a little bit about medicine, or the feeling of precision medicine, potentially being out of reach in certain countries and being more within reach in other countries. I'm wondering if some of the participants today might be feeling that precision medicine is a bit more out of reach at this time. At the same time, we also talk in this session today and in the From Testing to Targeted Treatments program about how every patient should really have the right to access medical innovations when it's appropriate for them. So I'm wondering if I'm turning the question now to Ransi, if you could share your insights in a resource-constrained landscape, such as in Nigeria. What are the kinds of advice that you could share, or important lessons you have learned towards improving access to precision medicine? I imagine it's still an ongoing journey, but if there are insights you could share, that would be fantastic.
Yeah, okay, thank you very much. And so there are multiple challenges. In 2016, Project Pink Blue, we raised money for a specific patient who was to take trastuzumab, which is Herceptin, one of the Herceptin, in 2016 or so. We raised, I think, about 16 million naira. 16 million naira for this patient to take, to be able to purchase this medication. We were really criticized a lot by many people, like, how would you raise this large amount of money just to save one patient, right? But I will tell you the power. The power was that after raising that money and we use it to support Comfort Oyayi, in fact, she became a very popular name in Nigeria, and I'm sure some people on this call will know her, Comfort Oyayi, because she was all over all social media. She still lived. She lived like almost, I think, about 4 years or 5 years before we lost her. But one major huge, but why I brought this story is just to explain one major huge challenge in low and middle income country in like Nigeria, it's really the cost. 16 million naira, it's a lot of money in 2016, right? And that's just for one patient. And only 5% of Nigerian population are covered by insurance. So you will definitely see how the burden is. People really have to pay for cancer from out of their pocket. Precision medicine is expensive. That's the reality, right? Other challenge is the workforce challenge. We have this poor referral system. Patient navigation is a very huge issue. And, and challenges to access to global funding and investment. These are also a huge challenge. Another very crucial issue around this challenge is that I'll give you an example. There is a consortium that is known as PAMED-NA Consortium, right? And it's the first consortium on implementation of precision medicine in North Africa, in Tunisia, Algeria, and Morocco. But this initiative, this consortium, were able to launch the precision medicine implementation because they got about €1 million grants from the Ministry of Europe and Foreign Affairs to coordinate this research. And they've started rolling out and started to do a lot of great work. What am I trying to say is that COVID taught us a good lesson globally, but immediately after COVID, it looks like our leaders still attend UN meetings, attend most of these global wealth meetings, and the lives still move ahead. Countries are still building territories. Countries are still not really engaged again in diversity, in inclusivity. So this is a huge challenge until we begin to understand that non-access of precision medicine or non-inclusion or non-diversity of data from low and middle income country in the biobank and in other genomic science is a problem, not just a problem for a country, but a problem for the world. Then making precision medicine would be, making progress in precision medicine in low and middle income would be a huge challenge. Now let me turn the table a little bit around to what we have done that we thought that has been working. One is global partnership focused on patient story. In Nigeria, and in particular in many low and middle income countries, we don't have many Bahija. We don't have many stories like the story Andrew have shared. We don't have many of them. We don't have many of cancer survivors. Many people will live the experience coming out to share their story. So we need to begin to document those stories. And what we have done is, with a stellar partnership that we did with the Global Colon Cancer Association, they provided funding for Project Pink Blue to launch a documentary film. That documentary film is titled Blood in My Stool. The reality is that the documentary was a story of 2 patients and their struggle with cancer, colorectal cancer. This is so important because in most of our countries, people just believe when you have cancer, it's a death sentence. But when we begin to show faces of hope, phases of change, phases of survivorship, then people will begin to really understand that precision medicine and other care is possible. The next one is also another solution could be empowering cancer, empowering patients, patient engagement, as I've shared before, and global advocacy. I was in ASCO last year, and when I stood up and I talked about that, many pharmaceutical companies are exiting Africa and exiting Nigeria. People were shocked, so we need to lift out, we need to share and speak out, at different levels and not just only in local level, both and in international level. Then the last thing I will say is empowering patients to speak out themselves, because patient voices are stronger. Thank you.
Thank you, Ransi, so much for your answer. And I wanted to follow up with a question for Marius. So Marius, you're representing a very important stakeholder with us today as a healthcare provider by background, and also someone who's involved in many public-private partnerships. And I'm curious if you could share some insights into how patients and patient organizations can work in partnership with healthcare professionals to improve outcomes for patients, of course, but also to advance and overcome some of the issues that we're discussing today. And it'd be interesting to hear your views on this, both at the care level, so just in the interaction, and this is shared decision-making, for example, but also from the broader partnership perspective as well.
Sure, thank you for your questions, Helena. And I will start actually quoting Rusi, who earlier discussed about how important it is to build this bottom-up movement in addition to top-down implementation of the personalized medicine. When I started this journey of policy and advocacy more than 10 years ago, my initial thought was, people are not aware, and I'm speaking about healthcare professionals mainly and policymakers, they are not aware of personalized medicine. So it's simply, I have to go and to explain, to go to the meetings and so on, and then things will happen immediately. Wrong. Then I said, okay, maybe it's not enough. Let's move to the next level. And I said, and we did some advocacy activities. We do not have time today to enter into more details. And in 2018, we catalyzed the formation of a personalized medicine committee, part of our Minister of Health in Romania, saying that, if you are able to change the organigram of the main health policy organization, and if you manage in such a committee to put high-level experts, they will start working towards a plan to implement personalized medicine, and they will be able to find the right political support and timely political support. Again, wrong. Then we moved to the next level, and we said, okay, maybe it's not enough to stay at the minister level and to try to set up a committee. And I briefly mentioned in my intervention that after many years, and we work a lot in a co-creation model using the pentahelix. Basically, we involved all the stakeholders, and we managed to catalyze this law on the right of the citizen and patients to personalized medicine in 23. And plus, the same year, the law on the National Cancer Control Plan, with having actually the core, the personalized medicine for prevention to treatment. And I said in 23, this is clear the moment for change. Wrong again. So, and basically, we are now in the situation to use all the advocacy and the policy and communication and education tools available, and basically with very, very few advancements. The way the biomarker testing program is looking now in Romania is something like was in France 10 years ago. And this is a key. I actually have some messages to you as patient representatives. One is that in these multi-stakeholder roundtables and meetings and so on, should somebody, and I think the patients are the most appropriate for this role, should assume the role of orchestrator. In other words, the person who to keep always the topic on the agenda and to align the opinion of the others and move the agenda forward. Because all the other stakeholders from, I don't know, from public bodies to healthcare professionals to the industry and so on, they might have other interests, other agendas, priorities, is normal. That's why, and we use this in building the law on the personalized medicine, right? We actually assume the role of orchestrator in this pentahelix model. The second message, and was already mentioned several times, personalized medicine is not a luxury. It's a right. It's a right. This is very clear. But it's an additional challenge, because personalized medicine is not just about clinical practice, but as well has a research component. It's like an infinity loop where the research and clinical practice are actually coming together and influence each other. So it's a slightly different model compared to the model healthcare professionals are used to. So this is a challenge. Another important message when implementing personalized medicine, we should all aim to implement the personalized medicine in our case of 2025, not the personalized medicine of 2015. So we are now, we have in Europe some advanced clinical trials, and yeah, access to clinical trials, again, it's a right, shouldn't be a luxury. I think it's a right. And coming back to this, so we have some clinical trials, so-called drug-like clinical trials, who is actually providing access to patients who for which the treatment options are not available anymore, based on biomarker identification. And in these trials, they offer access to drugs that are not approved and reimbursed for that. That's why it's important to have as well these regulatory aspects aligned in terms of this type of situation of and drugs. So this is happening in few Western European countries, and I think this is the state of the art when currently, if we're thinking to access to personalized medicine clinical trials. So there are a lot of challenges, and my message and for me, inspiration and some very powerful tools are actually coming from the cancer mission implementation at the European level, at the EU level, who is, to your point, Runsi, a bottom-up approach when it comes to cancer control. And hopefully into the future, we have more time and other chances to discuss more how to use this new type of participatory tools, such as living labs, and I mentioned already the pentahelix model of collaboration in order to really improve the uptake of the personalized medicine.
Thank you so much, Marius, for that answer. And I'm just looking at the time because we're nearly at the end of the session. I feel like it's difficult to fit all these answers and questions in. I wanted to make sure we have a bit of time just to give each speaker a few words to wrap up. So perhaps we can move there now, but if we can be creative and try to bring in the answer to a couple of the questions we didn't quite get to. So there was a question from Anna, and I guess this is a bit more on supporting an individual patient. I think this question came in actually before Runsi had done his presentation, and I believe, Runsi, in your presentation, you had gone through some advice for how we can support the individual patient. So I'm wondering if this aspect was already covered, but I'm wondering, Runsi, if you could just share what would be your key final conclusion, overall words of takeaway that you would like this group to take away with them based on the whole discussion today.
Okay, yeah, thank you very much. I think my last message will really be to collaborate. Driving progress in precision medicine and personalized medicine will not be possible by just working alone, by just doing it alone. This can only be possible when we collaborate and work with others who have gone beyond us. And I use collaboration because collaboration really is so different from competition, right? Because in competition, you are trying to struggle and know who is on the top. But when you are collaborating, everybody wins. Thank you so much.
Thanks so much, Ransi. And if I could invite Andrew, any closing words that you would like to share and for the listeners to take away with them?
It would be impossible to top these speakers. I mean, the advice that's been given is so practical, real world examples of success. As Ransi says, collaboration is the key. You can't walk this walk alone. Use the websites that are out there like ours, knowyourbiomarker.org. Get the patient stories. Like Ransi said, for 26 years, we have been monitoring where do patients go on our website? What are they interested in? Is it research about their disease? Is it the latest treatment options? Is it surgery? No, it's patient stories by far. People want to hear from other patients. So the collaboration that Ransi and my organization did in getting really the first patients to ever speak about colon cancer in Africa is so invaluable. I can't wait till that's launched and everybody can see it. Real world examples from patients are what people need to hear, policymakers need to hear. Money has to be put into this, so collaborate with other stakeholders who may financially benefit from this. It's all okay because the patient benefits in the end. So thank you to all these amazing speakers we had. I'm going to rewatch this again because I learned so much. Everybody should rewatch this again and listen to those great speakers.
Thank you, Andy. And Bahija, over to you. Any last comments that you would like to share?
Yes, thank you very much. In conclusion, I will end where I began. Advocacy is simple, and just be authentic, be yourself, and always be willing to learn from others. And it's something very important in our region. We start as a patient now. We are doing a lot for our communities, and our voices matter, and every life matters. And together we can create a world where cancer patients are not just victims or survivors, but strivers, enjoying a good quality of life. And sometimes we are looking from miracles, forgetting that we ourselves are the miracles. Thank you very much.
Thank you, Bahija. And final word from you, Marius, before I hand back over to Hussein.
Yes, so my final message is actually linked with the question coming from Shani in the Q&A chat. So personalized medicine, of course, is not such a new concept, but hopefully should become a mindset for all the people working in the health domain. And I'm sure that as well for lupus and other diseases, not only for cancer, when applying the personalized medicine, we'll be able to have better results in terms of efficacy and safety. And it's a great moment of opportunity with all the omics sciences, with artificial intelligence and digital twins, all contributing to change the traditional narrative when it comes to health and diseases.
If you allow me,
so much.
If you allow me to add something, it's time also to recognize the patient expertise, because it's sometimes we have to recognize the patient. It can save money, it can make a change and improve the care conditions in our region and in all, across the world. Thank you.
Thank you, Bahija. Thank you, all the panelists. Back to you, Hussein.
Yeah, thank you very much, Elena. So as we come to the end of this very excellent discussion on the promise of personalized medicine, I want to extend my deepest gratitude to all these esteemed panelists, speakers and participants for their valuable contribution. And my special thanks to FT3 for collaborating with us, the World Patient Alliance, and making this webinar possible. One key takeaway from today's discussion is that personalized medicine is not just a scientific breakthrough, it's a patient-centered movement. So as you know, we put it, it's not a luxury, it's a right. So by working together, we, the patients, advocates, researchers, and healthcare providers can accelerate progress and ensure that the innovation benefits all, regardless of geography or the socioeconomic status. So I encourage all of you to take the insights gained today and turn them into action, whether through advocacy, education, or policy engagement. Each of us has a role in shaping the future of personalized medicine. So once again, thank you for your participation and commitment. Let's continue to collaborate, innovate, and advocate for a world where personalized medicine is accessible to all. So wishing you all the best, and we look forward to continuing this important conversation. Thank you, and bye-bye to all.
Thank you. Bye-bye.
Thank you.
Thank you so much to the World Patient Alliance as well as F23 for hosting this. I think this is really interesting. I really enjoyed myself. And Andrew, thank you so much for sharing that story. You know, honestly, I really so inspired.
Yeah, this was a great webinar. Really, really great. I think everybody's going to walk away with really motivation, and we've given them the tools, and thank you. Thank all of you. These speakers were amazing today. I mean, amazing. So thank you all.
Yeah, and I think this is something I'm again thank to FT3, you know, for really putting
Oh
it
God,
together.
yeah.
Yeah. And I think this is something mainly I think we need to really have a discussion again and see, you know, how can we, you know, what should be the next step in this area. And I think let's start discussing on that, and let's continue this discussion, as I said in my closing remarks as well.
Absolutely. Happy to continue the discussion. Thank you so much. It was good to see everyone.
Thank you so much.
Thanks for everything, Helena. You're a
Congratulations.
champion.
Thank you. Thank you.
Thank you so
Bye-bye.
much, everyone.
Thank you.
Thank you
Bye.
all.
Yeah, bye.